countries severe acute respiratory syndrome coronavirus (SARS-CoV) and Middle East respiratory syndrome coronavirus (MERS-CoV) emerged from animal reservoirs to cause global epidemics with alarming morbidity and mortality. In December 2019, yet another pathogenic HCOV, 2019 novel coronavirus 2019 nCoV, was recognized in Wuhan, China. The virus can spread before symptoms show, China's health minister Ma Xiaowei said on Sunday, which suggests it'll be harder to limit transmission between people. Coronaviruses are large, enveloped, positive strand RNA viruses that can be divided into 4 genera, alpha, beta, delta, and gamma, of which alpha and beta co-viruses are known to infect humans. 0.14 HCOVs, HCOV 229E, NL63, OC43, and HKU1. There are confirmed cases of the virus across Asia, and within the US, Australia and Europe. So far, all cases outside China seem to be in people that have traveled from Hubei province, where the outbreak began, or the encompassing area. But we are likely to seek out if the virus will start spreading within these countries in the coming days and weeks. Confirmed cases are reported in the Republic of China, South Korea, Hong Kong, Macau, the US, Australia, Japan, Malaysia, Singapore, Taiwan, Nepal, Thailand, Vietnam, Canada and France. All of the recorded deaths have thus far been in Hubei province. Growing outbreak. The scale of the outbreak will depend upon how quickly and simply the virus is passed between people. Using data collected up to the 18th of January, it appears that, on the average, everyone infected with the virus passes it to between 1.5 and 3.5 people, consistent with an analysis by Natsuko Amai and her colleagues at Imperial College London. Using similar estimates, the University of Oxford predicts there's a 1 in 3 chance that an individual who brings the virus to the United Kingdom will pass it on to others within the country. That estimate is predicated on data collected from the start of the outbreak. They hopes that, as countries intensify measures to regulate the spread of the virus, the probabilities of this happening will subside likely. But there's still much we don't realize the virus, and a few researchers suggest that it could spread more quickly than estimated. One study, supported data collected between 11 and the 22nd of January, estimates that every person with the virus can pass it to between 3 and 5 people. The work by Shi Zhao at the Chinese University of Hong Kong and his colleagues suggests that the virus is far more contagious than originally thought. Thompson's estimate was calculated supported the idea that the virus isn't contagious until symptoms show, and this not seems to be the case. If the virus is in a position to spread before symptoms show, that would certainly explain why the virus is spreading quicker than SARS, says Thompson. The U.S. Centers for Disease Control and Prevention (CDC) cautions that, although only 5 cases are reported within the U.S. thus far, the person-to-person spread of the virus within the country is likely to occur to some extent. Lessons from SARS. Comparisons are drawn between pneumonia caused by the new virus and SARS, severe acute respiratory syndrome, which infected quite 8,020 people during a worldwide outbreak that began in 2003. The viruses are from an equivalent family, and both can cause fever and pneumonia. So far, the new virus seems to possess a lower death rate, supported the number of reported cases and deaths. The speed appears to be around 2.8%, compared with a 9.6% rate for SARS. But it's timely to make certain just how dangerous the virus is. We are still within the youth of the outbreak. The virus is spreading more quickly than SARS. SARS took several months to cause 1,000 cases, says Thompson. This has caused almost 3,000 cases in 3 weeks. The SARS outbreak was over by 2004. There are no reported cases since then. Health agencies brought the virus in check by isolating people with the virus, and screening aviation passengers. Such measures are going to be harder with an epidemic which will be spread before symptoms appear. There is also always an opportunity that the virus could mutate to become more contagious or deadly. However, there is no evidence yet that the virus has mutated within people, and thus the Planet Health Organization (WHO) told a press conference last week that the virus appears to be stable. So, how worried should we be? The WHO remains holding far away from declaring a public health emergency of international concern, although the organization says the danger of the virus is very high in China, high at the regional level and high at the worldwide level. The CDC describes the outbreak as a very serious public health threat. "I am pretty worried about the present situation," says Thompson. He expects the WHO to officially declare a public health emergency if and when the virus begins to spread between people outside China. Slowing the spread in the meantime, health authorities in China have undertaken unprecedented measures in an effort to regulate the spread of the virus. Wuhan, where the outbreak began, has been placed on lockdown, conveyance has been packed up, the airport is closed, and therefore the use of private automobiles has been banned. Immigration services within the city are suspended in Wuhan. Several other cities have also been placed in lockdown, affecting tens of many residents. Chinese authorities have also prolonged the Lunar New Year holiday. The general public holiday was thanks to Endways the 30th of January but has been extended until the 2nd of February, and schools and universities are remaining closed until further notice. A growing list of nations is screening air travelers from China. Mongolia has closed its borders with China, and therefore the government of Malaysia has said it won't issue visas to people from affected regions. The Chinese government has also temporarily banned the sale of wildlife in markets and restaurants. While the origins of the virus are still unclear, it's thought that the virus was passed from bats to people, possibly via snakes or minks. All of those animals were reportedly on sale at the Huanan Seafood Market in Wuhan, where the primary cases of the virus were reported. The Wildlife Conservation Society (WCS) has involved the ban to be made permanent. Poorly regulated, live animal markets mixed with illegal wildlife trade offer a singular opportunity for viruses to spill over from